3 dead after suspected hantavirus outbreak on cruise ship. 3 people have died following a suspected outbreak of hantavirus aboard a cruise ship sailing in the Atlantic Ocean, according to the World Health Organization, WHO. 1 case of hantavirus has been confirmed, while 5 additional suspected cases remain under investigation. The WHO told the BBC that detailed investigations into the suspected cases are ongoing, including further laboratory testing. The outbreak was reported on the cruise vessel MV Hondius, which departed from Argentina and was en route to Cape Verde. Below is what we currently know about hantavirus. What is hantavirus? Hantavirus refers to a group of viruses carried by rodents. Humans are typically infected by inhaling airborne particles contaminated with dried rodent droppings. Infections usually occur when the virus becomes airborne from rodent urine, feces, or saliva, according to the U.S. Centers for Disease Control and Prevention, CDC. Although rare, transmission can also occur through rodent bites or scratches. The virus can cause 2 serious diseases. Hantavirus pulmonary syndrome, HPS. This illness often begins with fatigue, fever, and muscle aches, followed by headaches, dizziness, chills, and gastrointestinal symptoms. Once respiratory symptoms develop, the mortality rate is approximately 38%, according to the CDC. Hemorrhagic fever with renal syndrome, HFRS. A more severe condition that primarily affects the kidneys. Advanced symptoms may include low blood pressure, internal bleeding, and acute kidney failure. Global cases of hantavirus. Approximately 150,000 cases of HFRS are reported globally each year, most of them occurring in Europe and Asia, according to the National Institutes of Health, NIH. More than half of these cases are typically reported in China. In the United States, data shows that from 1993, when hantavirus surveillance began, through 2023, a total of 890 cases have been recorded. However, the sole virus, a major strain of hantavirus carried by Norway rats, also known as brown rats, is found worldwide, including in the United States. Treatment and prevention. There is no specific cure for hantavirus infections. The CDC recommends supportive care to manage symptoms, which may include oxygen therapy, mechanical ventilation, antiviral medications, and even dialysis. Patients with severe symptoms may require hospitalization, particularly in intensive care units, ICU. In critical cases, some patients may need to be placed on ventilators. To reduce the risk of infection, the CDC advises minimizing exposure to rodents in homes and workplaces. This includes sealing entry points such as basements and attics where rodents may enter buildings. Additionally, wearing protective equipment when cleaning rodent droppings is recommended to avoid inhaling contaminated air. Recent cases. In February 2025, Betsy Arakawa, the wife of Oscar-winning actor Gene Hackman, died from a respiratory illness linked to hantavirus. Health investigators believe that Arakawa contracted hantavirus pulmonary syndrome, HPS, the most common form in the United States, which led to her death. Rodent nests and dead rodents were found in outbuildings near her home, where her body was discovered. Police records also revealed that Arakawa had searched online for information about flu and COVID-19 symptoms in the days leading up to her death.